Now, prostate cancer is probably the most common men cancer in the world, and in India, it is becoming the most common cancers in the men. It has reached the second common position in India. Any man above 40 is susceptible to get a prostate cancer, and it is much more common in men above 60. Now, how to diagnose prostate cancer and how do you find the symptoms of it? Many patients are diagnosed as an incidental point. That is, they don't have symptoms, they do a PSA test and therefore eventually get diagnosed with the cancer. But in terms of symptoms, men may report difficulty in urination, slow stream, sometimes even blood in the urine. So if you find urinary problems in yourself or in your near and dear, such as your parent, then it is important to approach your doctor for a test. Now, the prostate cancer itself, the way to diagnose is that you start with the examination by the doctor, a blood test called PSA, and subsequently, depending upon the suspicion, the doctor will order a test called MRI or a PSMA PET scan, and lastly will do a biopsy to confirm the diagnosis. Now, once diagnosed with prostate cancer, the options of treatment are many, and it can be divided into two broad options. One is a surgery where you remove the whole prostate, and other is radiation where we give radiation from outside. I'm going to talk about surgery, which is becoming probably the most common form of treatment in the world for this cancer. This is called radical prostatectomy. It can be done using open surgery, the conventional open surgery, or using a robotic technology. And in the world, the robotic radical prostatectomy has become the most popular, common surgical procedure using a robot and the surgical procedure for the prostate cancer. Now, it entails that the whole prostate is removed and the bladder is then stitched to the urethra in order to ensure the continuity of the urinary tract. And then the patient will stay in the hospital for either a day or two, and nowadays in Apollo we are doing this operation as a day case procedure. You come in the morning, go in the evening after the operation. Especially this is very important in the COVID era now, where patients want quick recovery and return back to home. After the operation, the patients notice a transient period of urinary incontinence and some impotence, and those can be helped for better recovery. Now, radical prostatectomy can also be part of a multimodality therapy where you want to give a sequencing of treatment for these patients in order to achieve what we call optimal care. Now, it is very important to know that not only we treat cancer, make the patient a cancer survivor, better term a cancer conqueror, but it is also important to maintain the quality of life of these patients. And for that, sequencing the treatment with the radical prostatectomy and if necessary a radiation afterwards will allow the patient to get the most optimal care with the least of the side effects. Now, this operation and the recovery has been made exceptionally better using robotic technology, which is once again available in Apollo hospitals, and the patient's recovery is ensured for its quickness and the quality of life that ensures after that as well. So viewers, my take-home message for you is that prostate cancer is a very common men's malignancy. Think about yourself to get a PSA test if you are above 40, and definitely recommend one for your parent or uncle. And if you get diagnosed, do not hesitate to get treated, for you can be cured of this cancer.